Yeah, you've seen this, right? 120/80. It's kind of held up as the gold standard for normal blood pressure. But what does that actually mean? And what's with the mmHg? Well, that just stands for millimeters of mercury. It's an old school unit of pressure we've stuck with. We're going to get into what it all means as we go.
So that's the big question, isn't it? We're going to break down exactly what those two numbers are telling you, why they're so incredibly important for your long-term health, and what you can actually do with that knowledge. Let's dive in.
Okay, first things first. Before we can really understand the numbers, we have to get back to basics. What is blood pressure? It's really just about the simple physics of how your body works.
Think about it like water flowing through a hose. Every time your heart beats, it gives a powerful push, sending blood out into your arteries. Blood pressure is simply the measure of how much force that blood is pushing against the walls of your arteries as it moves around. It's the pressure that keeps everything circulating.
Now, here's something that might surprise you. Your blood pressure is not one single static number. It's constantly in motion. It goes up when you're exercising, it drops when you're chilling on the couch, it can even change if you're stressed or excited. That fluctuation is completely normal. It's just your body adapting second by second.
So, you might be thinking, well, if it's always changing, why is it so important to track? Great question. It's because the average pressure over time gives us a really critical snapshot of your heart's health. It's often called a silent indicator, and for a good reason. You usually can't feel whether it's too high or too low.
And as you can see, there are real risks at both ends of the spectrum. High blood pressure, or hypertension, is a huge risk factor for things like heart attacks and strokes. But on the flip side, low blood pressure, or hypotension, can make you feel dizzy, cause you to faint, and in severe cases, it can be dangerous too. That's why the goal is to stay right in that healthy sweet spot.
All right, let's get to the part we all really want to know. What are those two numbers? The 120/80. That's not just one measurement. It's actually capturing two very different moments in your heart's rhythm.
Let's break it down real simple. The top number, that's the systolic pressure. Think of this as the action number. It's the peak pressure when your heart muscle is contracting and pushing blood out. That's the maximum force. Then you have the bottom number, diastolic pressure. That's the rest number. It's the pressure in your arteries when your heart relaxes between beats. It's the baseline pressure that's always there.
So let's see how these numbers fit onto the official chart. To be in the normal category, both your top number and your bottom number have to be in the right range. But check this out. Once you get into hypertension, things change. For stage 1, you only need one of the numbers to be in that higher range. A top number of 135 or a bottom number of 85 puts you in that category. Whichever number is higher determines your classification. And all the way at the top, you see hypertensive crisis. A reading of 180/120 or higher is a serious medical emergency.
Okay, so knowing the numbers is half the battle. But how do we actually get an accurate reading in the first place? Let's quickly demystify the test itself, because believe it or not, how you prep for it can make a really big difference.
Seriously, these simple steps can have a huge impact. Laying off the coffee, making a quick trip to the restroom, and just sitting quietly for 5 minutes before the test. All of this helps make sure the number reflects your true resting state, not the stress of, running late to your appointment.
And what's actually happening when that cuff tightens up? Well, it gets inflated just enough to momentarily stop the blood flow in your arm. Then, as it's slowly deflated, the nurse or doctor is listening with the stethoscope. That very first little tapping sound they hear, boom, that's your systolic pressure, the peak force. They keep listening, and the exact moment that tapping sound vanishes completely, that's your diastolic pressure, the resting force. And just like that, they have your two numbers.
Okay, so you've got your reading. You understand systolic and diastolic. So what's next? What do you actually do with this information? Let's talk about the next steps.
So let's say you're checking your blood pressure at home and you notice your numbers are consistently high, or maybe even low. That's a perfect time to check in with your provider. Same thing goes if you're feeling symptoms like dizziness or lightheadedness. It's always better to be proactive about this stuff. Now, it's also really important to know when a situation is a true emergency. If your reading is 180/120 or higher, and you have other symptoms like chest pain or trouble breathing, don't wait. That's a 911 call. Same goes for low blood pressure. If it causes you to faint and hit your head, or you see signs of shock, that's an emergency that needs immediate help.
At the end of the day, your blood pressure isn't just a number to write down on a chart. It's a piece of information you can actively use to protect your health. And this quote really says it all. When it comes to protecting your heart, you and your provider are a team. Knowing your numbers is your first step to being a key player on that team.
And remember, the tricky thing about high blood pressure is that you usually can't feel it. You can't just guess if you're in a healthy range. The only way to truly know for sure is to get it checked. So I'll just leave you with this one simple question. Do you know your numbers?